Mitral stenosis. Let's talk now about mitral stenosis. Here's the left atrium, here's the left ventricle, and this is the classic rheumatic mitral stenosis where this anterior mitral leaflet is very stiff and fibrosed from decades of inflammation and calcification, and the leaflets are stuck together. In the olden days, we used to have to go in, and they used to go in there, open the heart, and initially Dwight Harkin and them, they used to put the little fingers in, their little pinkies in, and kind of crack it apart. And then they used to, do it with forceps and stuff. This is in the olden days. Now the good news is we can do it with a balloon. So typically these individuals will come in fatigue, exertional dyspnea, orthopnea, and they'll have this classic triad on their x-ray. So the classic triad is they'll have the pulmonary hypertension, so the big pulmonary arteries, the big left atrium often poking out, and a normal-sized LV. So that is the classic MS chest x-ray. And as I mentioned, if they've got severe MS, then we can actually balloon them apart. And one thing we need to do, but before that, we have to do, all of these people have to get a TE before we do that. Because the TE has to confirm they have no left atrial thrombosis. Because, if we crack the valve apart and there's a big thrombus there, it could float off and go up to the brain and they could stroke. They can't have moderate to severe MR, because when we crack the valve, if they've got moderate to severe MR, it's going to get worse, okay? And then finally, we do this Wilkins score. It measures 4 different things, the valve itself, the amount of calcification, the subvalvar, the supravalvular apparatus, the papillary muscle. Each gets a score from 0, which is good, normal, to 4, which is bad. And we add all those up. So best score is 0, worst score is 16. If they have a Wilkins score of 8 or less, we can actually do the percutaneous mitral balloon commissurotomy, but we need to do the TEE. So if they pass the TEE and their Wilkins score is less than or equal to 8, send them for the percutaneous mitral balloon commissurotomy. If they do not pass all of those tests, they don't pass go, they have to go to the under the bright lights and the cold steel and get either surgery. If we can repair is always preferred to replacement. We can't beat Mother Nature, all right? So if we can, repair it, but if they can't, they'll need replacement. And here's the procedure where we actually go in and use a balloon and crack the valve apart. And the good thing is that with this, it's actually a one-time deal. You've basically cured them. They don't need to come back.